This segment is sponsored by Ohio Opioid Education Alliance.
During the second quarter of 2020, Ohio's death rate from opioid overdoses jumped to the highest rate seen in a decade. Here now to share some insight and offer some help is Ken Yeager. He is the clinical director at the Ohio State University's Wexner Medical Center. Good to see you today, Ken.
Good to see you as well. Thank you for having me.
Well, sorry, we have to talk about a new height. That's not good news. Can you tell us about, first of all, the work you're doing, and then we'll discuss some of these statistics.
Okay, so I am the director of the STAR program, Stress, Trauma, and Resilience. We offer a program through our Trauma Recovery Center that helps individuals who have been victims of crime, individuals who have lost family members due to crime, and we provide mental health and substance abuse treatment, as well as medication management, as well as case management for individuals who are being challenged by this coming together of high levels of anxiety and depression, along with substance misuse in Ohio.
Now, let's talk about these last 10 months. Many people are impacted, but people in particular who struggle with opioid issues, they have had a very difficult time, haven't they?
Yes, they have. It's difficult to put into perspective the increase in the number of opiate deaths over the past 10 months. And it's around a 17% increase, where we are seeing people who are also having concurrent issues of anxiety and depression. In the spring, the Government Statistical Office partnered with the Census Bureau to screen individuals as they were doing the census screening to check on mental health. Two things, in fact, anxiety and depression, which average around 12 to 15%. But in the spring, when they studied this, many states were at 40, 43%.
Wow.
Depression. So there's just a lot going on in the last 10 months. The pandemic, the social inequities, the social justice issues that have put people on edge.
And now especially, parents are, in most cases, around their children more with homeschooling and such. Why is it so important right now that parents take the time to talk about the dangers of drugs to their children?
It's a way of helping the children to know that their parents are there to hear them, to listen to them, to understand that there are other pathways that they can go. And I would say the most important thing is bringing up these issues as a point of conversation helps to normalize what we're seeing in the population, and it provides an opportunity to give education that will help the children to make better decisions.
Now, for our viewers out there, Ken, what can we tell them? It's a way of guiding them to help a friend or a sibling or a neighbor who could be dealing with mental health issues or substance use disorders.
You know, we continue to talk in hushed voices around mental health issues and substance misuse issues, when in fact we should not. We should bring it to the forefront. If we see a concern, we should verbalize the concern in a general way of seeking to help the person to find the help they need. And this is difficult because oftentimes people with substance use disorders are going to tell you they're fine. They don't need any help. In fact, they do, and you may not make that connection the first time, but please keep trying, because there will be a moment where the individual is open to suggestions of what they can do to help themselves.
Oh, wow. And in those moments of brightness, where can we send them to get some of the services or resources available through the Wexner Medical Center?
So we have Talbot Hall, which is the substance treatment facility of the Wexner Medical Center, and we also have OSU Harding Behavioral Health Care, where we are integrating current best practices, evidence-based approaches to treatment, and research to help us to continue to understand how these illnesses progress and what we can do to provide the very best frontline treatment.
Well, Ken, thank you so much for your time today and this important discussion. We truly appreciate it.
Thank you so much for having me.
And for more information on fighting the opioid epidemic, visit don'tliveinDenial.org.